So let's get started. Welcome everybody today to our technical assistance kickoff. My name is Amy O'Leary and I am the campaign director for Strategies for Children. And I have my colleagues introduce themselves and then we'll share a little bit of information about what we're going to talk today. So Titus, I'll turn it over to you.
Hello, everyone. Good afternoon. My name is Titus Daspromedius. I'm Director of Research and Policy at Strategies for Children, and I'll mainly be moderating the Q&A and the chat. So they're a little bit different. If you have a question you'd like everyone to see, I'd encourage you to use the Q&A form at the bottom of your screen, and other comments, of course, can always be put into the chat. Thank you.
And Marissa.
Hi, everyone. Oh, thanks. Hi, everyone. I'm Marissa Fear. I'm the project manager at Strategies for Children. I'm going to double down on what Titus said and encourage everyone to use the Q&A feature for questions. It's a little bit easier to monitor the questions and then show when there's a response or an answer. Thanks.
And right as we are holding two sessions. This one is going to be in English, and then one we are holding next week will be simultaneously translated into Spanish. So Marissa, if we can put that information in the chat so folks can know which session. And we also know the SEIU is also sponsoring meetings in different languages. So we'll make sure we share that information as well. As we get started, we're so happy to be with you today. And as you heard, Marissa, Titus, and I all work for Strategies for Children. And Strategies is a nonprofit advocacy and policy organization that works to ensure that Massachusetts invests the resources needed for all children from birth through age 5 to access high quality early education to prepare them for school and for life. And these are the areas where we work in. So the big headline is we are working in partnership with the State Department of Early Education and Care. We are not in government, we are outside of government and working with our partner organizations to help collect feedback, questions, and next steps as the state is working to work through the funding that's available through the federal packages, but also to think about what's really happening for programs across the state. So go to the next slide, Marissa. And so as we think about the conversation, the EEC stabilization grants in Massachusetts are funded by the American Rescue Plan. And that was signed by President Biden on March 11th, 2021. From that plan, Massachusetts had to come up with a plan to how to spend that money in Massachusetts. And there are some federal regs and rules that they have to follow. And every state is doing this across the country. And what Massachusetts has come up with is the Commonwealth Cares for Children, which has been now called the C3 formula, was created by EEC to distribute the federal funds. So we have to remember that this money sits on top of the current funding that we all are getting either from families or from the state to serve children in Massachusetts. And we knew this before, but it became even more clear during the pandemic that the current financing model for children is broken, that the subsidy rate doesn't cover the true cost of care. We know that all families who are eligible for subsidies cannot get a subsidy, that parent fee and tuition payments are unaffordable and some of the highest in the country, that too few children have access to high quality settings, too many early educators live on poverty wages, and too many early childhood programs are one payment away from closing or losing their homes. We also know that when this pandemic hit, early education and care providers across the state stepped up and supported children and families and each other over the last year and a half. We know that early education and care is a complex system. There are many different funding streams, both public and private. We know that we can't keep paying programs per child per day, and that programs need flexible, stable funds. And we believe that the Commonwealth Cares for Children formula is a way to really think about this and how we can ensure that more funding is going to all programs. We know that the state is listening. They want this to work for children, for families, and for programs. And your feedback is essential for moving forward. There are many other state and federal plans and legislation that really are about advocating for more public funding for early education and care. We'll talk about that. This is just one piece of the current relief, and there's a much bigger universe of advocacy opportunities. And this is an opportunity to build back stronger. We're seeing kind of questions around translation. This meeting today is not going to be translated. We will hold a meeting next week that will have simultaneous translation in English and Spanish. And everyone who registered for this webinar will get a follow-up email, and we will include the date and registration link for that. So EEC has designed a strategic plan portal, and there's the link. We will also send the slides so that everybody has this information. The engagement portal is the place to read about EEC's initiatives through 2025, to engage with surveys, to discover other opportunities, to hear about updates, and it's continuously evolving. I think sometimes we're not used to things continually changing and evolving, but this is a place where people should be checking out. You can work with teams of people so that someone's paying attention and monitoring these websites. We know that the state also hosted several engagement opportunities and has received feedback already from the field that has influenced how they are thinking about this going forward. And most recently, the development team shared the final C3 formula, and that you can walk through how the formula applies to different programs. And you can see the link below. If you click that, you will see all the updated information. What we're going to do now is launch a poll to get a better idea about kind of what people have had experience with so far. So you can see there are 4 different questions, and they are, 5. So you can read through the questions and vote, so we get a better sense of what people have had experience so far. So Laura, let us know what, you went the link to the portal in chat. Okay, we see people are voting. We have about 100 folks, a little over 100 folks voting. We really want to get this information. So if you are zoomed in, and you should see the poll on your screen, please let us know, because this, I think, will help us better determine how we can help support the field. If you have your hand raised, I'm not sure if you want to speak or if you have a comment to add. So if you could just either put it in the Q&A so we can track that, or put it in the chat. We see about, let's see, we have some. Great. Okay, we'll give it about 10 more seconds. We almost have 200 people voting. It's really helpful to see what information folks have already. And then after you do the vote, just what's the button? I'm not sure what the button is. Looks submit maybe. Okay, we'll give it 5, 4, 3, 2. We're at 199. Okay, we'll end the polling. So let me share the results. So it looks like 67% of folks who voted have attended an engagement session. 72% have reviewed the materials. Provided feedback, it looks like 89% have answered no. Will you be the person completing the application? 87% say yes. This is really important to know. And then the last question was, do you have administrative help to complete the application? And that's actually closer to 50-50, which is not what I expected. So that's interesting to think about, whether it's the program director, family child care provider. We know systems are also going to help family child care if you're part of a system. But so this is really helpful to see. Okay, so let's close the polling results. And then Marissa, I will turn it over to you.
Thank you, Amy. All right, everyone. It's nice to be with you today. So I'm just going to start by giving a brief overview of sort of all of the federal relief funds that were awarded to Massachusetts, and then zooming in directly on the American Rescue Plan Child Care Stabilization bucket, which is where this grant funding is coming from. So if you take a look at the timeline, you can see that in 2021, Massachusetts will receive, and then it sort of lists out the 3 buckets of funding. So the CRRSAA bucket of funding, Massachusetts was awarded $131 million. For the American Rescue Plan CCDBG bucket of funding, Massachusetts was awarded $196 million. And then what we'll be focusing on today is the American Rescue Plan Stabilization bucket of funding, where Massachusetts was awarded $314 million. What's important to note about this is that that's where this funding is coming from. So Massachusetts developed the C3 formula with an effort to sort of distribute the maximum amount of funding that they can to every program. It's also important to note that there are certain requirements from federal legislation. So in the federal legislation, it shares that 90% of the funds must be distributed as direct grants to providers. So that requirement really played a pretty big role, a significant role in EEC deciding to develop the C3 formula and have it be direct grants to providers. It's also important to note that eligible child care providers are those who were licensed or approved as of March 11th, 2021, when the legislation was signed. And that was something that comes from the federal legislation. All right. So I'm going to do sort of a brief overview of everything that we know so far. And I'll go into some of the specifics of the formula a little bit later on, but I thought it'd be helpful just to sort of to share what'll be important for you all as providers to know. We know that the formula is new and that there's a lot of information, and hopefully this helps to sort of share what we know so far and what will be important for you as a provider to know going into the application process. So what we know is that all providers in Massachusetts that were licensed or approved as of March 11th, 2021, and that are operating at the time of the application are eligible. The C3 formula calculates your stabilization grant amount, and you will be able to calculate your grant amount online. So this isn't something where you'll have to figure out how much money will be awarded to you. You'll be able to input the information that we have listed here, and that will go into the calculation, and then the calculator will tell you how much your grant amount will be. So the information that goes into that calculation is your program type. So whether you're licensed as a group and school age program or a family child care provider, your licensed capacity. For all family child care providers, EEC made the decision to award them a licensed capacity of 10 because one of the pieces of feedback that the department heard from providers was that they wanted to limit the amount of information that EEC collects from providers. So this was a way of sort of saying, regardless of what your actual license capacity is as a family child care provider, we're going to award all family child care providers 10. You don't need to change your license capacity in any way. This is just how they are going to be awarding the grant to you. The number of staff in your program. So if you're a center-based, the number of full-time equivalent staff members that you have in your program is going to be an important number to know. And then if you are a family child care provider, whether you are working alone or if you have a part-time or full-time assistant. And then finally, your program's location. This will be important for the Social Vulnerability Index score, which is one measure that EEC is using to calculate an equity adjustment, or your subsidy enrollment to qualify for the equity adjustment. So I want to highlight this. There are two ways to qualify for the equity adjustment. The first one is the Social Vulnerability Index, and the second one is your subsidy enrollment. And then finally, the stabilization grants will be distributed in 6 monthly payments.
So as Marissa said, and just want to kind of reiterate a few things. And if you have a question, use the Q&A bucket on the bottom of Zoom so that we can track the questions there. Remember, we are not the state. We are working with the State Department. So the questions that you're asking about hours and FTEs, many of that will be covered with the actual application. It's great to better understand what the questions are, because that's the kind of information we are going to tell the state, that they have to make these things very clear. We will talk after Marissa goes through kind of the components, and we know it's a lot of information and Zoom may not be the best way of doing it, but we will share the feedback that we have heard from the state already and from the field, and think about things like having a 1-page information sheet about everything that you're going to need to know to complete the application process, or what questions you have before you even start doing it. So keep the questions coming through Q&A. Remember that we are an outside nonprofit organization trying to help both the field and communicate back with the state, so that people can share feedback with us that they might not want to tell EEC. And then we want to keep this feedback loop going. The other thing that we know that we've heard is a clear timeline so that people can understand what's happening. I did ask you not to shoot the messenger or to have unrealistic expectations for the messenger. We at Strategies believe in accurate information, and we are going to make sure that that is one of our basic principles, because that's I think where a lot of the trouble is, that people are hearing misinformation or they're hearing about other states. So we want to make sure we have clear and concise information. Back to you, Marissa.
May I add one more point? So Marissa is going to cover much of the information that I see people asking questions about, and then we will answer individual questions, I think, once we take a break, right, Marissa?
Yes, that's perfect. There's also a feature where we can say in the question and answer function whether the question was answered live. So if I answer anything live, we can go ahead and mark it on that.
I'll do that.
But these are also great questions.
Yeah, and to Amy's point, I know the full-time equivalent, how that is calculated and what sort of goes into that calculation has been a question that's come up. We've already sort of relayed that to EEC, and they're being really intentional about how they will define that and how that will be explained in the application process. So that's definitely a good one to point out. All right, so back to sort of what we know and framing this discussion before we get into the formula specifics. So we know that programs have suffered heavy financial losses during the COVID-19 pandemic and throughout the child care closure. The C3 formula is meant to target approximately 10% of your program operating costs, and it will not replace all funding lost during COVID-19 as much as we might want it to. I think it's important to point this out, and also to point out sort of where this bucket of funding is coming from, that it is coming from the American Rescue Plan, and that it is being distributed to providers in an equitable way so that all providers are eligible for something, but that it is a limited amount of funding and that it is not enough to cover the financial losses that programs experienced throughout the past year. I'm also going to explain a little bit more about the equity adjustment during this. So EEC will calculate an equity adjustment on top of a base rate that determines your grant amount. They'll calculate the equity adjustment using the Social Vulnerability Index or subsidy enrollment, and then they'll use the value that is more beneficial to providers within each category. So for example, when they are calculating the Social Vulnerability Index, they can calculate it either at the census tract level or at your zip code level, which is a little bit of a larger area normally. Depending on which of those numbers is higher, they will award that number to the provider to give them a more beneficial sort of report. Same thing for subsidy enrollment. EEC is going to calculate subsidy enrollment at 2 different points in time, and they will use the value that is, again, more beneficial to providers. Zooming in a little bit more on the Social Vulnerability Index, the index provides additional funding to providers, both subsidized and private pay, that are serving vulnerable children and communities. It was developed by the CDC, and the scores range from 0 to 1. You'll be able to calculate and see your score online. So what will end up happening, will sort of more of the specifics of this will come out as the department rolls it out, but you'll be able to plug in sort of your program's address, and you'll be able to see your social vulnerability score online. We know that the application will be available in multiple languages: English, Spanish, Portuguese, and Mandarin. We also know that there may be providers that need assistance in additional languages, and that would be something that I'd encourage all of you to share with us today. If you know of providers, or if you are a provider who needs assistance in additional languages, because that's sort of a role that we're hoping to play, is to connect providers with some of those language interpretation and translation services. We also know that this operates in addition to current state funding and does not replace the private pay daily rates or the existing subsidy system. This is a one-time federal relief grant that will be distributed to all providers in Massachusetts. We also know that there will be an appeals process for many aspects of the grant application. So if you have a specific circumstance for your specific program that may not fit into some of the questions that are asked on the application, or it may not totally sort of share with the state who you're serving and sort of where your program is located, there will be an appeals process for you to be able to share some more information with the department.
And as we think about these slides, the headline is, the state is trying to figure out how to allocate funding in a very new way. If you think about the current way now, you either get it through a subsidy that a parent has to have for you to have, either a contract or a voucher. And even for the workforce, right now, the only mechanism we have had is the rate reserve, which goes to support subsidized programs. This is designed to take a much broader look at all the programs in Massachusetts and determine a way to equitably distribute funding on top of what you're already getting to help close and support the operating costs. And as Marissa said, it's only 10%. This is not meant to fill in the huge hole that was there before COVID and has gotten deeper. This is really meant to say, we have this money from the federal government. We want to make sure that we get it to as many programs that serve children and families as possible. And these are the ways that we're thinking about doing it. But this is very new, so we can't apply our kind of current way of thinking about how things work to the way that we're trying to do this. The state has also said that this is a 6-month time period, because they want to make sure they don't make any permanent decisions if there are things that need to be adjusted or tweaked, which is the one way we're going to learn this, is kind of doing this together.
Agreed. Thanks, Amy.
And Marissa, there were a few questions about school age programs and after school. So just to clarify, if you are a school age program or after school, you're eligible for this funding, correct? If you're
Yes.
EEC licensed.
Exactly. So if you are licensed by EEC, you are eligible for this funding. You just have to be open and operating at the time of application. All right, so now we've sort of condensed.
Now get ready. This is a lot of information. Let's not get lost in the details. We're going to have lots of opportunity to work this through, but this is just the philosophy of how they're thinking about getting the money out.
Agreed. So what we've done here is we've split this slide into sort of a group and school age category and a family child care category, understanding that there's some differences in the formula between those two licensing groups. I'll do my best to explain this in sort of the most high level and slow way that I can, so that everyone sort of understands. But like Amy said, it's a lot of information. I think it'll be helpful for everyone to get the slides and the follow-up email and be able to look through this yourselves. I'll also encourage you to watch the EEC presentation on the strategic portal, which goes into much more detail onto the individual aspects of the formula, as well as some specific examples for how it might apply to a specific program. All right, so the total grant amount is calculated based on a base amount, and then some programs will receive an equity adjustment. So the total amount of that grant will be distributed to programs across 6 monthly payments. That's sort of the first place to start at. All right, so zooming in at the base amount. The base amount is calculated based on 3 criteria. The first one is that programs will be awarded $500 per licensed slot in their program. This is for group and school age only that we're focusing on right now. So $500 per licensed slot. The second category is the license capacity. And then the third is your staffing level adjustment. So the way the base amount is calculated is you multiply $500 by the license capacity in your program, and then you multiply that again by a staffing level adjustment. So the way the staffing level adjustment is calculated, it's a range from between 1 and 3. So the minimum adjustment you will get is 1. The maximum adjustment you can get is 3. So if you were to get a maximum adjustment, you would multiply 500 by your license capacity by 3. If you were to get the minimum, you would multiply it by 1. The way the adjustment is calculated is you take your license capacity and you divide it by 10. That's what EEC has determined to be a baseline full-time educator equivalent. You take that number and you divide it by the number of staff that are working, the number of full-time staff that are working in your program. And that will give you a number and a range, and you can qualify for an adjustment between 1 and 3. It's a lot of math, I know, but once you sort of plug in the numbers for your specific program, it makes a little bit more sense. Now we're going to take a look at the equity adjustment. So there's 2 levels to the equity adjustment. First level takes your base amount and multiplies it by 30%. The second level takes your base amount and multiplies it by 40%. To qualify for a level 1 equity adjustment, you have to be a program whose location is in a place that receives a social vulnerability index score greater than or equal to 0.55 and less than 0.75. Or you have to be a program that has between 1/3 and 2/3 of its licensed capacity children receiving subsidy. So there's 2 ways to qualify for that level 1 adjustment. You either have to have a social vulnerability index score between 0.55 and 0.75, or you have to have between 1/3 and 2/3 of your licensed capacity for children receiving subsidy. For the level 2 equity adjustment, you take your base amount and you multiply it by 40%. To qualify for a level 2 equity adjustment, you have to have a social vulnerability index score greater than or equal to 0.75. And remember, the social vulnerability index is between 0 and 1. And the scores are based on either the census tract location or your zip code. So your social vulnerability index score has to be greater than or equal to 0.75, or 2/3 or more of your licensed capacity has to be made up of children receiving subsidies.
And Marissa, there was a question in the chat about what if we don't have a subsidy? And this is why. So there's one measure is a subsidy. The other measure is a social vulnerability index. And there's a question that is the CDC has come up with this definition, and we can get you more information on that. It's really meant to look at many different indicators in a community to see how much support is needed or could be needed in a community.
I can elaborate on that a little bit. So I think for the department, we know that there's more. We know that not every child is receiving not every vulnerable child is receiving a subsidy, and that there are plenty of providers who are not part of the subsidy system who are serving vulnerable children in communities. So the social vulnerability index is sort of the way for the department to capture that group of providers who are not part of the current subsidy system, but are still serving those children. So yes, you do not have to be part of the subsidy system to qualify for an equity adjustment. So just to clarify one last time, the total grant amount is your base amount plus the equity adjustment. All right, so now we're going to talk a little bit more about family childcare. Many aspects of this formula are the exact same, but there's a couple differences with license capacity and with the staffing level adjustment for family childcare providers. So the total grant amount is your base amount plus the equity adjustment for some providers who will qualify, and that amount is distributed across 6 monthly payments. It's made up of the base amount is made up of 3 categories again. So $500 per license slot, the license capacity, and then the staffing level adjustment. So what's important to note for license capacity is that EEC is awarding a license capacity of 10 for all family child care providers, regardless of their true license capacity. So
And that-
every family child, go ahead.
We just had a clarification in chat from Robin Brooks about that doesn't mean that you suddenly start serving 10 kids. That means no matter how many kids you have, they're counting for the math for this, they're counting 10.
Agreed. So there, you will not need to change your license capacity. You won't need to change your license at all. You won't need to be serving any more children. This is just the state's way of awarding family child care providers a license capacity of 10, regardless. So for family child care providers, you take $500 multiplied by the license capacity of 10, so 500 times 10, and then you have a staffing level adjustment. So if you have no assistant in your family child care program, the adjustment is 1. If you have a part-time assistant, the adjustment is 1.5. And if you have a full-time assistant, the adjustment is 2. So for example, if you were to be a family child care program who has a full-time assistant, you would take $500 times 10 for license capacity times 2 for a full-time assistant. Now looking at the equity adjustment, this is the same for center-based and group and school age. So to qualify for a level 1 equity adjustment, you take the base amount and you multiply it by 30%. To qualify for a level 2 equity adjustment, you take the base amount and you multiply it by 40%. So for level 1, you have to have a social vulnerability index score between 0.55 and 0.75, or you have to have between 1/3 and 2/3 of your license capacity dedicated to children receiving subsidy. To qualify for a level 2 equity adjustment, you have to have a social vulnerability index score greater than or equal to 0.75, or 2/3 or more of your license capacity is children enrolled receiving subsidy. All right, so back to the beginning again, the total grant amount is the base amount plus the equity adjustment, and that's distributed across 6 monthly payments. I know that was a lot of information. I hope that that was enough sort of detail and that was explained. So we'll go back to the question and answer a little bit later and see if there's any specifics about the formula that I can answer, but we'll move on a little bit for now and share some more about
Can I
how
just
we've
say
been.
one thing, Marissa? One thing we have told the state over and over that we have heard is that we need examples with real numbers to even just understand what you're talking about and to break it down so that it's very easy for whoever's filling it out to understand what numbers go where. So while this is a lot of information and can be maybe causing you a lot more questions than you had, just know that this is why we want to think about what support we'll need to make sure is in place as people are going through this. So in your head, I would caution against trying to figure everything out right now, but just understand the state is trying to determine a way to allocate funding in a very different way to ensure that we aren't just using the only proxies we have had, which has been a subsidy and a rate reserve, to allocate that funding. They heard that programs that don't accept subsidies or don't have, there's not enough subsidy dollars, need help and support. So just take a deep breath and think about that. And we need the specific questions because we know that we're going to have a Q&A document. We know that we're going to have more opportunities to clarify things. So as the questions are so helpful to know where people are or what we need to explain better or in a different way.
Agreed. I also think it's important to point out that there will be online resources where you can sort of plug in your license capacity information, whether you're a family child care provider with an assistant or whether the number of educators that work in your program is a group and school age program, and the formula will calculate it for you. So there won't be a lot of sort of calculation that you'll need to do. It'll be conducted through the system as well. And same thing for the social vulnerability index. You'll be able to enter your address, the program address, and calculate the social vulnerability index score. So I'm going to turn it back over to Amy, who will explain a little bit more about our daily advocacy call, and how we've been collecting information from the field.
Can I add one more point, Marissa?
Yeah.
So there was a question about an appeals process. So we know there will be a website where you can find out your social vulnerability score. If you don't qualify, will you be able to document your family's needs some other way and present that data to EEC?
Yes, so there will be an appeals process. We don't know the specifics of what would be important information to gather from your families. However, we've had some initial conversations with the department about this, and it sounds like understanding sort of where your families live. So if you're not in an area that qualifies for a higher social vulnerability index score, but your families live in an area that does, so understanding sort of where they live and their addresses. And then income information, as difficult as it is to say, that's something that the state doesn't have information on, and we know that many providers don't have information on their family's specific income information. But the social vulnerability index is sort of a way of calculating who are the most vulnerable children and families and communities in Massachusetts. And without sort of that specific information, we don't really have a way of calculating that. So I'd encourage everyone to start by just knowing where your families live, and if that information falls into a different social vulnerability index score than where your current program is.
And so we're going to go to Q&A, but we just wanted to let you know that as this information, and first we want to say all three of us have been in classrooms and programs, in our careers. So we know, that's why we wanted to ask that question at the beginning, like, are you the one writing this application? What support do you have? Because we know that people are working so hard and have worked so hard over the past year and a half. And we want to make this as easy and as automated as possible. One of the things Strategies for Children has done is we have a call every morning from 9:30 to 10 a.m. And I know some folks can't make it because they're directly working with children and families. But what we would encourage you to do is at least sign up to get the call information and email updates, because we send an email after every call every day with additional resources to kind of keep you posted on what's been happening. We also have guest speakers. Folks from EEC come. Today we had a very robust, powerful talk about the workforce, because we know that the legislature is looking for ideas about how to better support the workforce. We send a follow-up email. We can connect you to other events. We are also going to be continuing to use the 9:30 call as a place for this feedback loop. It won't be the only place where we're going to do that. We're going to hold additional sessions in throughout the next couple of months, but this is a really good touch point. We know that there are social media groups on Facebook, and so I would encourage you, if you are seeing lots of questions, or if people are really mad about something, or there seems to be something that's that people need an answer to, please connect with us. This is one way to do it, because once we have your email, you'll be on the list that we'll send every day. And then what's next, Marissa? Okay. Before we get to the Q&A and kind of some of the bigger themes that we're seeing to collect, we will send the slides. You will get a follow-up email. We will pull out all the links in the follow-up email, and please share that with other people. So this is what we have heard. We know that providers have faced many barriers in the past when they're applying for grants. We have heard about all the challenges of the workforce grant, and believe me, EEC has too. But what we have heard so far are kind of these themes. Providers will need application materials translated into preferred languages. Many providers will need technology support. The field will need to support of how to complete it, just the logistics of like, where do I log in? What questions do I have to answer? And who do I contact if I need support? And then the state will need to balance the need for data, right? This is an opportunity to collect a lot of data with how much they already should know about programs. So we have heard this over and over that I shouldn't have to fill it out 7 times. Think if I'm applying for something and it's my program name and my license number, things should auto-populate so that I'm not filling in all that information. We have sent a clear message that people want transparency. They want to know why you're asking the question, what it has to do with what's, how it connects to the funding that might be available, or the bigger picture of getting better data about children and families. But they really want to know and be part of that decision making and influence. If this is what you want to know, this is how you should be asking me that question. Because I think sometimes it can be, everyone thinks they're being clear, and then we're not getting to the real question of the answer. Before we go, we have one more poll, because we want to get now that you've heard all this and may have more questions than when you started, we want to think about the next part, which is the TA that you need. So as you've heard, we want to know from you right now, and you can pick all that apply. As you think about the kinds of technical assistance or the help that you're going to need, please choose, is it one-on-one assistance? Is it working in a small group to complete the application? Clear step-by-step info sheet to help you get through it? Do you need videos to show the process? Do you need a way to get in touch with specific questions about your own program? And if there's something that you didn't see here that would be helpful as you think about this, and it could be where you are right now, and your need may change later once there's more information out, but kind of where you sit right now after hearing what we have, after all the robust, good questions that you asked, what else would be helpful?
And then if there's time, I think for the Q&A, we still have many questions in the Q&A that I was not able to get to. So we can probably go from top to bottom and try and answer as many as we can.
And to kind of set level set expectations, we may not have the answers, but we will certainly give the questions and advocate to make sure that we have the answers. It would be good to talk to a human being. We have shared that. Okay, I'm going to give about 15 more seconds. So please, if the TA needs, if you can just let us know what would be most helpful. We have some things coming in through chat. We will also save the chat, save the Q&A, and figure out how to integrate all this good information we're having. Okay, I'm going to give it 5, 4, 3, 2, 1. Okay, I'm going to end the polling and I'm going to share the results. So the big winner, a clear step-by-step information sheet to prepare with the questions for the application. And then followed, wow, that's interesting. So specific questions and videos to show the process. And then other ideas, so please add them in chat. Okay, that's really helpful to hear. And we have some good ideas in chat, like a place for ask for clarity during applying. So it's like, as I'm doing it, I need help, talk to a human being. The long time frame for the application, a phone number for questions. Somebody had like, can you preview it before I submit it? That's it. And maybe it's not the state, maybe it's somebody who went through it and felt good about the way that they were doing it. Oh my goodness, 59 questions in Q&A.
Before we start going through the
great.
questions, I'm just going to share this one last slide here, just sort of outlining that we're part of this broader effort to support the field. As Amy said earlier, we are not the Department of Early Education and Care. We're not part of state government at all. So there are going to be some questions in this Q&A that we are unable to answer. But as Amy said, we'll share that feedback with the department. And our goal is sort of to collect all of these questions and to help inform frequently asked questions documents or Q&A document from the department that does answer some of these more specific questions. We're continuing to explore technical assistance and supports for the field with other partners throughout the state, and when EEC will share this more information with the field when it becomes available. So right now, what we have on the books is that SEIU 509 is hosting additional information sessions this week and next for all family child care providers. in multiple languages, and you can see more information on those sessions in LEAD. And then we are hosting 2 meetings, the one now and then one next Tuesday from 7 to 8 p.m., which we will send also in the follow-up email. And that session will be translated. The materials will be translated into Spanish and it will be interpreted live. To gather sort of more feedback from the field on what additional specific supports are needed. And now we can turn it over to question and answer. The only thing I'll say is that if you have any questions or feedback on the C3 formula or the stabilization grant application process, we've created a Google form that we will be sharing with the department, so please fill it out. And then also we've dedicated an email, project manager at Early Education for All, to this process, so you can feel free to email any questions, comments, or concerns to that email address. I'll also just encourage everyone to stay in touch with Strategies for Children. You can sign up for our SFC email updates and advocacy alerts. I've seen a couple questions in the Q&A just asking if this is one-time money, if this is going to be annual, that it's hard to, to give someone a raise if it's only one-time funding. And we completely agree. We are advocating for more funding for the early education and care system every day. And we think that your voices are so important to that discussion and that we want you to be a part of that advocacy. So sign up for those alerts and follow us on social media. We'll continue to share updates throughout the next few months this summer as the application rolls out. And we'll likely do that over social media and through our email alerts. So I'm going to go ahead and stop sharing now, and then we can start doing some Q&A.
So Marissa, I think, let me run through it quickly. So anything that's like the first question is like the webinar mentioned keeping published hours up to date. Any of those kind of tactical logistical questions, I think we're not going to answer now, but we're going to say that's got to be part of the feedback we give the state. Are there different considerations as far as funds for campus-based programs? The intention is for all licensed programs, right, Marissa?
Yep. So if you have an EEC license and you are open and operating at the time of application, you are eligible for this fund. So regardless of any of the sort of specifics for your program, if you hold a license by EEC, you are eligible.
The quantifying FTE is a question that keeps coming up, so we're not going to answer it, but we're gonna reiterate that keeps coming up. Is there a timeline for when funding needs to be used by?
That is a great question. I believe, I'm going back to the slides real quick. So I believe that I'm going to have to check on that one because I don't want to give the wrong answer, but
because there could be an answer when the state has to get the funds out or when you as a program have to use. Exactly. We have heard this question about grant money being taxed. We're trying to understand that both at the federal level and the state level. And if you are going to be taxed, we want to maybe think about other advocacy opportunities to change that. Staff full-time, all those questions. License capacity and number of staff include all sites or just the main site. We know this question has come up with umbrella organizations, so that might be a specific question, which I know they're going to work on an answer for. Are these grants taxed? Do you put 10? Again, as Marissa said, when it comes down to the actual math, there will be support through the formula to say, are you a family child care provider? And it will hopefully will insert 10, right?
Yep.
As a provider who was licensed in April, can you be eligible?
So if you were licensed in April of 2021, so the federal requirements state that you had to be licensed at the time that the federal legislation was passed. So the federal legislation was passed March 11th, 2021. So if you were licensed after that, you would not be eligible for this funding.
6 months of payments will be the end of funding or can be renewed. Again, that depends on what happens at the federal level, if there's money available. How will they be counting school age hours? Is there a time? Do we have the timing yet for the due dates and all of that?
We don't have the specific timeline. It'll be 6 months worth of grants. And the hope is that the application will be available sometime later this summer.
The question, will everyone get some funding or will some programs be ineligible? To be eligible?
This is not a competitive grant. So as long as you meet the eligibility criteria, you will receive funding.
And then Pedro had a question about FTEs. What if your license capacity changes during the 6 month period?
That's a great question. So there's the way the application will work is you'll sort of fill out the initial first month, and then for each month after that, if there are changes to your staffing level or to your license capacity, you can go back into the application and make changes, and your grant amount will update. So that's that's sort of one way that they'll handle that. If nothing changes for you across the 6 months, you just go in and you'll be able to verify that nothing has changed, and you won't have to complete the application each month.
The ratio question, if you have lower ratios 1 to 6, that has come up. They are sticking with 1 to 10 because it's for birth through, it's across a continuum, right, Marissa?
So it's a little bit of a complicated answer. So that's sort of where the staffing adjustment comes in. So the way that EEC is sort of acknowledging that infants and toddlers have lower ratios than preschool age children is through that staffing adjustment. So when you end up plugging in the number of staff that work in your program, and let's say you have more infant and toddler classrooms, you'll have a higher number of staff. So when you calculate that number, you might lean more towards the adjustment of 3 rather than an adjustment of 1.
So to be determined with the math, but again, the intention is to better support programs in a way that we haven't done before. Does Head Start factor as SDI or in place of subsidies? I haven't heard a direct. That's an interesting question.
It is an interesting question. I guess it depends. So if your Head Start program accepts public subsidy through either contracts or vouchers, you would sort of qualify through that mechanism. But my understanding is that it's not sort of an either or. It's like if you qualify for one or the other, you receive the equity adjustment.
The base amount, okay, I see Petco has, for base amount related to equity adjustment is a 500 times license or the number after you include staffing level. We'll get back to you on that, Peg. Opening September 1st would begin the process. I'm not sure if that's if your program is opening September 1st or the grant. Your program had to have been open by March 11th, 2021.
Correct.
When can you start filling out the application? Stay tuned for that. Show you how to do the SVI. We will get you more information. How the percentage of subsidies will be calculated. It's going to be 2 points in time.
Yes. So I think it's one date that's pre-pandemic and then one date that's more recent. So whichever of those two your subsidy percentage is higher at, that's how EEC will calculate that. And same for the social vulnerability index. They'll take both your zip code and your census tract, and whichever of the two is higher, that's the number that you'll be awarded.
Restrictions on how the money can be used. We didn't even get into that. That will be kind of phase 2 of like, once you apply for this, how can you think about using this funding in your programs? Lots of questions about staffing. If you have two part-time employees, can you pay consultants? So we've thought about getting some pro bono accountant help, or that tax question, or what does this mean for your bottom line? So stay tuned for that. Do the vouchers have to be state vouchers, or will the child care aware vouchers? They should all be. So if it's military, that's still considered. Yeah. The FTE we know is confusing, so we'll make sure we get more information on that. We'll send the Marissa, we'll put the daily link in the call for the sign up.
Yes. We'll send all of this in the follow-up email. So I'll include the 9:30 daily advocacy call as well as our Strategies for Children email sign-up link so that you all have all the links.
Will present enrollment be considered to receive or calculate the amount? This is one shift the state has made to get away from trying to pay per kid for coming, right? It's your capacity.
Right. So rather than try, because we know enrollment's low right now across the country. So rather than trying to calculate a grant based on enrollment, they're calculating it based on your licensed capacity. So let's say you're licensed for 20 children, but only 6 are attending right now. You receive the licensed capacity of 20 in the grant amount, or that's what's calculated.
Thank you for start the process of collecting income information. It's a fallacy that everyone who lives in high income is high income. Yes, I mean, I think this is where the state is really trying to better understand that. And that's where we really were challenged during COVID when we didn't have any of that data. When we apply for the grant and submit it, do we find out right away? That's a good logistical question. We'll try to get some answers. Will program be audited on how funds are spent? Again, I think there's a spirit of we want to give funds to be spent in a certain way. So we can't answer the audit question, but it's something to consider to either make clear about what the accountability and follow-up looks like. Having been burned twice by technical error, I would hope that the process would not have that guideline. So I think if you can give us a specific, like, this is what happened to me, I tried to save everything and lost it, or I thought I submitted it, but it didn't really go in. So any kind of those real small details would be helpful. When will the application start rolling out? They're still finalizing this. They've said July. We may give them some grace and expect it in August. So I have a license for 10, but my assistant is my wife. What should I use? So that's a good specific question that we can get some clarification on, or at least pose to the state. SBI is based on county. How is their equity? So we can do a little more digging about that, about looking across the state.
So I know that EEC is looking into both the census tract, because that's how SBI is calculated, and then also your zip code. And I know I want to say that they're looking into using 2019 data instead of 2018 data because it's a little bit more accurate, being more recent. So there should be some sort of variability there between the two. I know census tract is typically a much smaller area because it's a smaller group of people compared to zip code. So hopefully there should be enough sort of wiggle room there to account for some of those differences, like between Haverhill and Lawrence.
Haverhill, sorry, Marissa.
Thank you.
Massachusetts. How will you know it's available? So we know that sometimes the department sends things through lead. So better understand if you're not getting communication, make sure you know who's that person. We will be sending out information. Hopefully that will not be a challenge with this grant with this application. My reopened in August after 2020. So some personal situations. Will I be able to apply? Again, that's something I think we need the state to answer. You're going to apply once from what we understand, but you'll have the opportunity to update changes during that 6-month period. Is that right, Marissa?
Sorry, I just want to go back to so they reopened in August of 2020. So they should be, but we'll be reopening soon. So yeah, right. You'll have to just check and see with the EEC whether you've maintained your license this entire time.
Right.
And then you'll have to be open at the time of application.
So we don't know a published list of what, we'll get to that part about what the money can be used for.
And then the question about apply once or every 6 months. So the way it will work is that you'll apply the initial time for the first sort of month payment. And then each month you can go in and either reauthorize and say that nothing has changed, that you can just continue receiving your grant amount. Or if something has changed, like you've hired new educators, you've increased your license capacity as a center group and school age program. If things like that have changed over the course of a month, you can go in and enter the new information and receive sort of the new grant amount.
So it's 2 p.m. and we want to honor this, but the questions are great. Well, again, we're going to have another session that will be simultaneously translated in English and Spanish. And the SEIU is also addressing more specific questions around family child care. So we're going to share these questions with them as well so they can make sure. And then, so.
I just add, I think a lot of folks have similar questions around, is this out yet? When can I click the link? When can I find my information?
Right.
I've been typing into all of the questions. Be sure to check your EEC emails. EEC will release the information in the coming weeks. We don't have a date yet, but it will be coming soon. Check your emails from EEC. When the application is live, there will be a link to enter your address to find out your social vulnerability index and to do the application. It will probably be through the LEAD portal, correct? That this application will take place. So, make sure that you have access to that.
There might be,
yeah, I'm not sure if the application itself will be through LEAD, but I'm sure there will be information in LEAD. I'd also encourage everyone to sign up for the commissioner's inbox, which I will also include in the follow-up email. The Department of Early Education Care has a sort of commissioner's inbox that goes out pretty frequently, and they often include email updates in that.
Stay in touch with us. If you hear something and you have a question, ask us. Say, I heard this. I don't know if this is true. This is setting some panic in the field. We want to make sure that people are getting accurate, helpful, useful information. And we need folks to tell us back, like, this is getting confusing. People think it's this. Everyone's frustrated. We want to hear that. We want to thank everybody for joining us today. If you go to our Strategies for Children website, you'll see all of our contact information. And Marissa, we have everybody's registration form. This was recorded, and we'll send the dates for the SEIU sessions as well as our next session next week. So thanks to everybody. Thanks to Marissa and Titus. Thanks for the great questions and conversation. And we look forward to staying in touch with you and getting through this together. Thanks, everybody, and have a great day.